The importance of breastfeeding is also evident in its significantly positive impact on our planet. This is because breast milk is a natural and renewable food which requires no preparation, no packaging, no storage, no transportation to its environmentally friendly, and it is environmentally friendly and suitable. The earth benefits when women are encouraged to breastfeed their infants and young children. Therefore, the enabling environment for breastfeeding must be created by society at large for this to happen. Breastfeeding is a win-win situation for infants and mothers and the nation, the environment, and the planet. Exclusive breastfeeding is the right of all newborn infants. Therefore, let us all play our parts to protect the right for all infants to be breastfed exclusively for the first 6 months of life, with introduction of appropriate complementary food from the family menu from 6 months, and continue breastfeeding for up to 2 years and beyond if possible.
So for us in the Federal Ministry of Health, as we all know, the ministry remains committed to improving survival of children, especially children under 5 years in Nigeria, within the scope of our mandate to realize universal health care coverage, leaving no one behind. So we are strongly committed to ensure that quality services, nutritional support are provided to children under 5 years within the scope and spectrum of the reproductive, maternal, newborn, child health, adolescent, and nutrition, including also care of the elderly. The Ministry of Health have made some efforts in addition to providing a supportive environment, an enabling environment that will promote breastfeeding in Nigeria. We have further gone beyond promoting baby-friendly hospital initiative and have currently developed what we call the baby-friendly initiative, which goes beyond the health facility. All environment, including workplaces, marketplaces, should be made very friendly for mothers to have confidence and effectively breastfeed their babies, especially within the first 6 months of life. So we continue to promote that and continue to advocate for workplaces to have safe spaces that will ensure privacy and confidentiality for mothers to continue to breastfeed. In addition also, as we are currently battling with the COVID-19 pandemic, we are also stepping up efforts to continue to promote, protect, and support breastfeeding, especially within the first 6 months of life, exclusive breastfeeding. And we continue to educate mothers, families, and communities. Despite the COVID pandemic, mothers should continue to breastfeed their babies, but ensure that they observe all the preventive precautions. Use of the face mask before feeding, irrespective of mother status, whether COVID-19 positive. Use the face mask to protect yourself, hand washing under running water, and use of the sanitizer to protect the baby, because the benefits at the end of it outweighs the risk of transmission of COVID-19 to the baby. I'm glad to mention that a lot has been achieved over the years, and we hardly see now promotion of breast milk substitute by manufacturers within health facilities. But more need to be done, especially in communities, to ensure that breast milk substitute manufacturers do not follow mothers to their homes to continue to cause the distraction.
Breastfeeding in Nigeria is very high. Almost every woman will breastfeed. But exclusive breastfeeding is still not yet at the stage or at the level we want it to be. And there are many reasons for this and concern, which we have as policymakers and policy implementers have to work around. I don't know the specific figure. I know it was 17%, but it's risen to 29%. Mrs. Is it still 29%? I think I'm correct. So it's still 29%. But the lower one is that only about 9% of workplace have environment for exclusive breastfeeding. So therefore, we have the code for 40 years. We've done quite a lot of things to promote the code. But the enabling environment that will make the code to work, we still need to work on this. Because increasingly, women are working. We can do a lot of media promotion. We can checkmate people being encouraged by health workers when they deliver to start early breastfeeding and exclusive breastfeeding. But then, are there supporting environment? And I think this is one of the things that we as policymakers have to do. Since we came in 2 years ago into the National Assembly, I've had discussions with UNICEF and I think with Life and Tribe on how we can change the law to be able to implement 6-month maternity leave, because it's still not yet universal. So one of the things I want to say at this particular occasion is that we need to work together as stakeholders to ensure that we achieve that. And I want us to give a target that within the next 6 months, we should be able to pass that law. And then, but it requires all stakeholders to be able to do. When we do this, and it should be across board, it should be for all employers of labor, both the public and private. There are some states, some public sectors, like Kaduna also, who currently implement that. But we need to make it to be across board, particularly with the private sector. Private sector engages more women. And it becomes a barrier, particularly some commercial institutions like banks and so on. They put restrictions. Even some places still say you resume back after 6 weeks. How do you want the woman to now exclusively breastfeed? Of course, there are all, we know that you can extract, put it at home and so on. Where we don't have, I mean, where do you keep it? You keep it at room temperature and so on. There are all the challenges. But where the woman is at home and also has support of other family members, exclusive breastfeeding will be promoted. The second thing we need to promote as policy is the workplace environment. Because after exclusive breastfeeding, we still will require, for continuous breastfeeding and for effective nutrition of our children, we still need to be able to provide environment for women to be able to nurse their babies. Because after 6 months, when the woman resumes, it doesn't mean breastfeeding has stopped. And a lot of time, the women will require, and despite the patronage of the salary that they are receiving, they have to now get a helper to nurse the baby, either with extracted breast milk or with supplement between morning and afternoon. Usually it's in the evening. So, but if there's a working environment that supports this, the woman will be able to go. I've worked in friendly environment like that. When I work with Save the Children, we have that. And you can see that most of the women are able to take care of their children. This is critical, and that's the final point I want to make, that why are we promoting breastfeeding? I mean, several comments have been made, but it is already proven. I heard when the director was saying, he spoke about studies in Ghana. We have a lot of studies in Nigeria. We have a lot of studies which has proven the advantages of breastfeeding. And as we know it, and it's been shown that productivity, IQ, and intelligence have a direct correlation with breastfeeding. And so it's therefore important for us as policymakers and as implementers and stakeholders to ensure that the future is better than today by making every baby, every child that is born, to not only have early breastfeeding, but exclusive breastfeeding and continuous breastfeeding and appropriate nutrition.
It was developed as a global public health strategy with the aim of contributing to the provision of safe and adequate nutrition for infants by protecting and promoting breastfeeding and by ensuring the proper use of breast milk substitutes only when they are necessary, on the basis of adequate information and through appropriate marketing and distribution. Essentially, the code is to protect mothers from the aggressive marketing of breast milk substitutes and ensure safe feeding and better nutrition for infants and young children. The provisions of the code recommend restrictions on the marketing of breast milk substitutes. Nigeria, a member of the WHO, voted for code adoption in 1981 and was therefore expected to implement all its provisions in their entirety as a minimum requirement and to translate it into national legislation, regulations, or other suitable measures. It is a well-known fact that breast milk, also known as human milk, gives the baby the best nutritional start in life and also provides vital immunological benefits. No other food offers such total nourishment to the baby for the first 6 months of life. Exclusive breastfeeding for the first 6 months of life, followed with complementary feeding after the age of 6 completed months, that's 180 days, and continue breastfeeding till the child is age 24 months or beyond, is the global recommendation for optimal infant and young child feeding, IYCF, and the key to healthy growth and development.
Okay, so he's covering one.
Okay, thank you very much. Thank you so much.
So please sit down.
So this is a journey of
Please come back. Let's get the whole of that.